Hello everyone, this video will discuss and provide 4 special tests and 1 clinical prediction rule to assist with the assessment of cervical radiculopathy. The first test is called the upper limb tension tests, ULTT, is also known the LV test or brachioplexus tension test. It is used for checking cervical spine radiculopathy by provocation the nerve roots supplying the upper extremity. Furthermore, this test is divided in 4 different tension tests to screen for median nerve, ulnar nerve, and radial nerve. There are 2 versions of the median nerve test. The first version start with the patient assume in supine position. The examiner depress the shoulder girdle, following shoulder abduct 110 degrees. Then, extend the elbow, supinate the forearm, extend the wrist and fingers. Lastly, the examiner instruct the patient to contralateral cervical side bend. A positive test is when symptom is reproduced similar to patient radicular symptoms. This bias the median nerve, anterior interosseous nerve, C5, C6, and C7. The second version continues to test the median nerve, biasing the musculocutaneous nerve and axillary nerve. This test start with the patient assume in supine position. The examiner depress the shoulder girdle, following shoulder abduction to 10 degrees with shoulder external rotation. Then, extend the elbow, supinate the forearm, extend the wrist and fingers. Lastly, the examiner instruct the patient to contralateral cervical side bend. A positive test is when symptom is reproduced similar to patient radicular symptoms. Next is the radial nerve tension test. The patient assume in supine position and the examiner depress the shoulder girdle. Then abduct the shoulder 10 degrees, extend the elbow, supinate the forearm, flex the wrist, fingers, ulnar deviate, and finally internal rotate the shoulder. The examiner then asks the patient to contralateral side bend. A positive test is when symptom is reproduced similar to patient radicular symptoms. Next is the ulnar nerve tension test. The patient assume in supine position and the examiner depress the shoulder girdle. Then abduct the shoulder 10 degrees and place shoulder hand to ear. Then flex the elbow, supinate the forearm, wrist and finger extension, radial deviation, external rotate the shoulder, and instruct the patient to perform contralateral cervical side bend. A positive test is when symptom is reproduced similar to patient radicular symptoms. The second test is the SPURLING'S test. The patient is in seated position with neutral cervical posture. The examiner instruct the patient to flex his or her head to the side of the referred symptoms. If no symptoms, then the examiner instruct patient to side bend the head to the side of referred symptoms. If no symptoms, the examiner then applies combined compression force in this position. Test is positive when the patient report the referred radicular symptoms or pain. The third test is the cervical distraction test. The patient is in supine position and the examiner assess for symptoms of radicular pain. If no symptoms, then the examiner uses the chin cradle grip around the head of patient and apply a traction force. A positive test is when the patient's symptom is reduced with the traction. The fourth test is the cervical rotation test. The examiner instruct the patient rotate his or her head to the involved side. A positive test is when patient rotate to the involved side less than 60 degrees. Lastly, to further strengthen the cervical radiculopathy assessment by using the Untitled rule, which consists of 4 different tests that mentioned in this video to confirm cervical radicular syndrome. 3 positive tests out of 4 yield a positive likelihood ratio of 6.1 and 4 positive tests lead to a positive likelihood ratio of 30.3. Again, thank you for watching. Please subscribe and leave a comment if you like this video.